Hello guys, welcome back. This is Dr. Hadi here. Today we will discuss the deficiency of vitamin A. Deficiency of vitamin means the lack of vitamin, no supply to the body. When vitamin A is less in your body or absent in your body, what will be the result of this problem? This is called deficiency of vitamin. And so today we will discuss the deficiency of vitamin A. There are a lot of vitamins. Each vitamin has its own deficiency. So first of all, we need to know that how this deficiency is caused. So there are three ways by which vitamin A deficiency can be encountered. The first one is a person is not taking vitamin A from the diet, from outside. This is very simple. He or she is not taking proper fruit, vegetables, or those food which contain vitamin A. So this will cause a problem, definitely. This is the first that everyone knows. Second problem is very important, that is the impaired intestinal absorption. In this case, a person is taking care of his body, is taking care of his health, but the problem is that once these vitamins enter his or her body, the vitamins reach to the intestine of that person, and from the intestine vitamin has to travel to the blood, which is called absorption. Process is called what? Absorption. Vitamin A absorption from the intestine into the blood is required, is very important, crucial. But some people do not have this ability of absorption, means especially an alcoholic person, those who drink alcohol, they have vitamin absorption issues all time. So that's why in this kind of person, vitamin A cannot be absorbed into the blood. Although the person is rich, he has having a lot of vitamin source, she is taking these, but from intestine, it is not entering into the blood. So this is the second reason. The third reason is what? Reduced storage in the liver. You know, vitamin A is a fat soluble vitamin. And we also know that fat soluble vitamins can be stored in the liver. Fat soluble vitamin A, D, E, K. So vitamin A can be stored in the liver. For example, if you are not taking vitamin from outside for some time, it's okay, no problem. Your liver will provide vitamin A to the blood for a specific time. So some people, they do not have this ability to store vitamin A in the liver. Hence, the problem can be caused. Vitamin A deficiency may be encountered. Right. Now, what will happen if vitamin A deficiency comes? The very first thing is the night blindness. Night blindness will not be discussed in detail today. Why? Because it is already discussed in my topic, visual cycle, vitamin A word cycle. Each and every thing is discussed, the mechanism of how vitamin A is involved in our eye, in looking at the objects, seeing the objects in the day and night time. Both are discussed in detail. So if vitamin A is deficient, what will happen? Night blindness will be there. Night blindness, which is also called as nyctalopia. In this, the person feels difficulty to see objects in the dim light, means not in the daylight, but in the dim light. When he or she enters a room where there is no light, there is dim light, he or she cannot see objects properly. This is called night blindness. So this is the first thing. Second thing is the xerophthalmia. In xerophthalmia, what happens that the cornea of the eye gets dry. Okay. In order to explain xerophthalmia, keratomalacia, skin and epithelial others, I need to tell you something about epithelial tissue in your body. You know, our body contains epithelial tissue in cells, epithelial cells. These are present mostly on your body surface, on the skin and inside body. And kidney, respiratory tract, even epithelial cells are also present in your eyes. Fine. Epithelial tissue can be found in two states. One is the normal state. One is the normal state. Other is the problematic state, disease state. Normal state is what? That if you see on these cells, the surface is smooth. The surface is smooth. There is no sharp objects. There are no sharp objects. The surface is quite smooth. But in this case, if you see, the surface contains some projections like this and this and this. So, of course, these are epithelial cells, epithelial tissue, but the surface is not smooth. This is called rough surface. R-O-U-G-H, rough surface. And why it happens? Actually, there is a special protein called keratin. Keratin protein, when they are produced on the surface of the cells, they raise themselves like in this position, and this leads to the roughness of the surface. This is called keratinization. Skin is not smooth, and this is called keratinization. Keratin protein causes keratinization. So I would like to write here keratinization. Now, once you got this idea of keratin protein, now I will come back to your eye. Inside eye, if we see here, this is your eye, and here you can see there is a gland called the lacrimal gland. Lacrimal gland produces liquid, right? Tear, we can say tear. This leads to the wetness of the eyeball. And here the eyelids. When you close your eyelids, open, close, each time, the eyelid and the eyeball, there is friction between the eyelid and the eyeballs. And you know, when you rub two surfaces together, heat is produced, and this may cause pain and inflammation. But have you ever think that why pain is not produced, why inflammation is not produced in your eye? Because of the liquid. As far as liquid is there, it will provide us lubrication, natural lubrication, no problem at all. But when vitamin A is deficient, this lacrimal gland contains epithelial tissue. Yes, epithelial cells are there. So the lacrimal gland become keratinized. Once it is keratinized, epithelial tissue has been keratinized, then this ability is lost. So what will happen? Dryness will be there. Your cornea, the upper layer of the eye, I suppose this is your eye, this layer is called the cornea. The cornea becomes dry, and this condition is called xerophthalmia. Dryness of the cornea or keratinization of the epithelial cells. First one. Then keratomalacia. If the condition persists, means if the dryness persists, then what will happen? Some white spots, triangular white spots, will produce in your eye. These white spots are called Bitot spots. Bitot spots. And the cornea will start degenerating. Degenerating means breakdown. Simple, cornea will break down. Once cornea is broken down, this condition is called keratomalacia, degeneration or destruction of the cornea. It's very difficult to see then. Also another case. Okay, now coming to the growth and the reproduction. In case of growth, it is already discussed that vitamin A act like hormone. Although vitamin A is not hormone, but it act like hormone. How? It enters your cell. Inside your cell, it enters the nucleus. Inside the nucleus, vitamin A enters the DNA and it attaches itself with the DNA. This is your DNA. Vitamin A attach with your DNA. Your DNA is just your control center. So vitamin A once attached with your DNA, it start giving signal to the DNA to produce particular protein by the help of expressing one specific gene. So protein formation by the help of specific gene is involved in growth and differentiation. If vitamin A is absent, there will be no protein, there will be no proper growth and differentiation. This is next one. And then we have reproduction. Vitamin A has its role in the reproduction as well. The studies have been taken on the animals in the lab. Some animals were taken and they were given a diet which was lacking vitamin A. First of all, they took female mice. When female mice was made vitamin A deficient, then no pregnancy was seen. Pregnancy was seen in the beginning, but no maintenance was there. Means if an animal is made vitamin A deficient, then that animal can be pregnant, but it cannot maintain its pregnancy for a long time. This is for female. In case of male, if male mice animal is made vitamin A deficient, means mice is placed in the lab, food is given to the mice, but the food does not contain vitamin A, definitely the mice will suffer vitamin A deficiency, although mice is not allowed to go here and there. So male mice was observed to produce sperms which were immature. You know, for the reproduction, sperm cells, the male gamete cells, needs to be mature, but these were not mature. So vitamin A deficiency cause great issue in the reproduction. And now skin and the epithelial cells. In case of skin, as I have already mentioned, that if vitamin A is deficient, your skin contain epithelial cells and epithelial cell will start producing keratin protein. Keratin protein will make your skin horny. Horny means projections like this, raised projections, horny, rough type of skin. Scaly and rough skin will be produced. So it actually affects the beauty. And second, epithelial cells. This was already discussed here, epithelial cells, but let me tell you something more. Epithelial cells are present in your respiratory tract, eye and urinary tract. If the respiratory tract epithelial cells are keratinized, what will happen? Then infection will be increased. in the infection in the respiratory tract will be increased. Why? Because if the surface is smooth, bacteria, virus cannot cause damage, significant damage to your throat or to the airway. But once the epithelial tissue becomes like this, then bacteria can easily trap in this, virus can easily trap, and they can stay here for long. If they get the ability to stay here, then this cause infection from the bacteria. So as a result, infection. You know, if your body is protecting you from the bacteria and virus, this is called immunity. This is called what? Immunity. So vitamin A is involved in immunity a little bit, right? In this regard. If vitamin A is deficient, so you will be having infection in the respiratory tract. And regarding eye, I will put a star here because I have already discussed that if vitamin A is deficient inside your eye, your lacrimal gland will not be able to produce significant tear or the liquid, so that friction is reduced. So it will cause xerophthalmia, dryness of the cornea, and destruction of the cornea, called keratomalacia. So done. Inside your urinary tract, right? Kidney, urinary system, epithelial tissue is still there. If epithelial tissue is damaged, vitamin A deficiency, then what happens? There is a chance that stone is produced. Calculi. It's called what? Calculi. Stone can be produced in your kidney because of vitamin A. Right. So this is done. And now I would like to tell you one thing more. The deficiency of vitamin A. It is done. And now vitamin A has some of its role in the teeth and bone growth. Vitamin A is also involved in teeth and bone growth. Your bone contains matrix, the strengthening material of the bone that gives strength. The matrix contain what? Mucopolysaccharide. Mucopolysaccharide is combination of what? Carbohydrates and protein. The mucopolysaccharide is synthesized by the help of vitamin A. This is fine. If vitamin A is there working properly, mucopolysaccharide will be there. Mucopolysaccharide is there, matrix will be okay. Matrix is okay, bone is okay. Vitamin A deficiency, no mucopolysaccharide. Matrix problematic, bone will not be a strong bone. So that is why vitamin A is also involved in the growth of the bone and teeth. Now the last thing is beta carotene. I have already told you what is beta carotene. In the structure of vitamin A, we have discussed that beta carotene is actually vitamin A, but it is from plant side. Those people who use a lot of vegetables, means he or she is taking beta carotene, and this is very good. That's why doctor said to take vegetables as much as possible. So if you take beta carotene, what will happen in your body? Beta carotene will provide you one advantage, that is antioxidant. Antioxidant means that no tissue damage. It will protect your tissue from the damage. One. And anti-cancer. Maybe if inside the cell some cells become cancerous, so beta carotene will help remove the cancer cells from the body. So anti-cancer power and antioxidant power, both are given from the beta carotene side. This was all about the deficiency of vitamin A. I hope you got this. I will give you one short summary that in today's lecture we have learned that vitamin A can be deficiency, the vitamin A deficiency can be there in 3 ways. Number 1, not taking food from outside. Number 2, no proper absorption from intestine to the blood. Number 3, liver storage problem. And then we saw that vitamin A has a very famous role in eye, means if vitamin A is deficiency, the person will not be able to see in the dim light. And then we saw that vitamin A has a very prominent role in the epithelial tissues. In epithelial tissue, vitamin A deficiency causes the roughness. The roughness means raised projections will be there, and that is called as keratinization. Because of which protein? Because of keratin protein. Keratin protein cause keratinization. And if an epithelial tissue is keratinized, then the problems can be seen in different parts of the body. Means if epithelial tissue is keratinized inside your eye, these two problems will be seen in xerophthalmia and keratomalacia. If epithelial tissue is keratinized in your skin, then your skin will be rough and scaly. If epithelial tissue is problematic in your kidney, then calculi will be formed, stone will be formed. If it is keratinized in the respiratory tract, infection will be there. And last thing was there, vitamin A is also involved in the synthesis of mucopolysaccharide, which are responsible for the healthy growth of the bone. So no vitamin A, these deficiencies will be there. I hope you got this whole topic. In the next topic, we will proceed to the next vitamin, that is vitamin D. So take rest and bye-bye.